Welcome, and a very big thank you for your interest in the plan for a decent social security system. My name's Ellen Morrison, and I'm co-chair of the Commission on Social Security, which has produced the plan. I'm a social security claimant and a disabled activist. I first got involved in the Commission through Disabled People Against Cuts. We were going to launch our plan with a large-scale event in person with speakers, poetry, and lots more. Unfortunately, because of COVID, we haven't been able to do that. But we still wanted to publish the plan. So here it is. And it's now available on our website at www.commissiononsocialsecurity.org. And to mark the publication of the plan and to explain what's in it, Dr. Kate Summers and I have done a question and answer video to hopefully give you more information about the Commission's work. Kate is a British Academy Fellow in Methodology at London School of Economics. The Q&A is around half an hour, or if you're interested in specific bits of information, we've got lots of additional notes and a formal project report to complement our plan on the website. So check them out at www.commissiononsocialsecurity.org.
Hi, my name's Kate Summers, and like Ellen said, I work at the London School of Economics, where I'm a fellow in qualitative methodology. My focus is on developing new qualitative methods, and particularly thinking about how we can research and learn more about social security policy. I've been part of the Commission on Social Security support team, and my responsibility is for evaluation and learning. It's great that the commissioners have produced the plan for a decent social security system, which Ellen has shown us the front cover of just now. And like Ellen said as well, it's now available on the Commission's website. So once more, that is www.commissiononsocialsecurity.org. I'm delighted to be here with the Commission co-chair, Ellen Morrison. And Ellen's going to be the one answering the questions today. She's going to explain more about the plan. And I'm going to be the one asking a few questions. So, Ellen, looking through the plan, we can see that there are 5 parts to it. So there's a part on a guaranteed decent income, next about increased child benefit, then a PIP replacement, links with other key areas, and finally about having a totally new ethos. And before we get into the detail of those different sections, some people will already be familiar with the Commission's work, but others, they might be newer to what you and your colleagues have been doing. Could you start by giving us a quick summary about what the Commission on Social Security is about?
Thanks, Kate. Yes, so to briefly explain, there are many problems with current welfare benefits. Sanctions, the 2-child limit, the way disabled people and carers are treated, it's a really long list. But so far, there hasn't been any agreement on what a better system would look like. So the Commission on Social Security project was set up to come up with proposals for what that better system could look like. Me and the other commissioners are all experts by experience. So we all have experience of the current benefit system. And commissioners have a whole mix of experience between us. But rather than speak for them, they're going to introduce themselves.
My name is Ellen Clifford. I am very proud to be co-chair of the Commission on Social Security. I have been working in the disability sector for the past 20 plus years. I am a mental health service user and also a benefit claimant myself.
My name is Nigel. I'm one of the commissioners on the Commission on Social Security. I represent Waltham Forest Stand Up for Your Rights on the Commission.
My name's Osmond, and I'm a commissioner by experience for the Social Security Commission. I've been a long time recipient of benefits.
Hi everybody, my name is Sarifa Patel. I'm one of the commissioners for Social Security Commission. I am an Asian disabled woman from the BME background.
Hi, I'm Catherine Hale and I'm one of the commissioners. I founded the Chronic Illness Inclusion Project and I also have experience of claiming disability benefits going back more than 20 years.
Hi, I'm Mike. I volunteer at a benefit support group in the Southwark area of South London, and as part of that I've been nominated to be one of the commissioners on the Commission for Social Security.
Hi, my name's Barry and I'm one of the commissioners.
Hello, my name is Latoya and I am the deaf representative on the Commissions on Social Security.
That's great. And I've seen as well that there's more information about the commissioners, their photos and a bit of information about them on the website that people can go to and look at if they're interested. So getting back to the proposals for a new social security system, obviously that's a huge task. Can you tell us how you approached that, how you went about it?
Yeah, so the first thing we did was to agree principles that should underpin social security. People may have heard them before, but we always make a point of repeating the principles because they've guided everything that we've done and they show the kind of social security system that we want.
Ellen, how else did you go about identifying proposals for a better social security system?
So literally thousands of people have contributed to this process, and we didn't just sit in a room dreaming up our own ideas. We tried to involve as many people as possible with a real breadth of lived experience in that and see where consensus can be built. Going back to 2019, we made a call for solutions. We wanted to hear from as many people as possible what their solutions were to what is widely understood as a broken system currently. We got those ideas back, pulled them together, and then in 2020, we put them back out to public consultation in the form of draft proposals. We got lots of feedback on those draft proposals and questions and comments, and that all helped us draw things into our plan for a better social security system. And then in October 2021, we had a preview event to get yet more feedback. And now we've tweaked it some more and it's ready for everyone to see. And I think it's also worth saying, since we started our project in 2018, we've had a legislative theatre event, a poetry day, 2 rounds of workshops across the UK, and all sorts as well as that. And for anyone who wants to find out more about the process, because I think the process in itself has been really interesting in terms of us trying to make sure everything we do has been as inclusive and accessible as we can make it. So there's more detail on that now on our website.
Great. Thanks, Ellen. And I think it's worth saying that the plan is the document that has all of the key information in it. But like you were just explaining, there's lots of further information on the website and also in the project report that people can have a look at. So let's start to get into some of the detail of the plan. Could you summarize in one sentence what it's about?
Well, you've already mentioned that there are 5 parts of the plan. So a guaranteed decent income, increased child benefit, a PIP replacement, those links with other areas, and a totally new ethos. And that's correct. But if I had to say what we're doing in one sentence, I would go back to the first couple of principles we set out and say what our plan does is make sure, 1, everyone has enough money to live, and 2, supports the extra costs that people face, like if they're a disabled person or have children, and thirdly, treating everyone with dignity, respect, and trust.
Thanks. And starting then to get into a bit more detail. So we currently have a system where we've got several different working age benefits. So universal credit, job seekers allowance, ESA, etc., etc. But what you and the other commissioners are proposing is what you're calling a guaranteed decent income. Can you tell me what that's about, please?
Yeah, so the guaranteed decent income is the way of achieving that first principle. So making sure everyone has enough money to live. And pages 9 to 13 set out details, but I think there are a few things worth emphasizing. Firstly, it's a completely new approach. So it scraps universal credit, no conditionality about job search, no cap, and no sanctions. Second, it would be individual and not couple-based, so completely different to universal credit and the standard approach to benefits. And third, the traditional approach to means testing would be abolished. And instead, we're proposing an approach that's more like a light touch tax self-assessment. And fourth, it will provide the amount identified in the Joseph Rowntree Foundation minimum income standard, which works out the amount of money that's needed for an acceptable standard of living.
And how much money would people actually get?
So we've worked out the way to meet that Joseph Rowntree Foundation minimum income standard is to set guaranteed decent income at 50% of minimum wage. So currently that's £163.50 a week. So two people living together and both getting full GDI would get £327, and that meets the minimum income standard level. And there would be a single householder supplement of £63.50, and that's about 20% of the minimum wage. So a single householder would get £163 plus £63.50 a week, and that also meets that minimum income standard.
Thanks, Ellen. That's a lot of numbers thrown at us, but that's really helpful to know the actual figures. I guess some people might ask, why not go for a system where there are more benefits based on national insurance contributions? What would you say to that?
Well, I think national insurance contributory benefits can discriminate against disabled people, women, and young people. They can play a role within social security, but they don't provide that basis for ensuring everyone has enough money to live, whereas the guaranteed decent income does.
And what would you say to other people who might advocate for a universal basic income? So why wouldn't a UBI be the answer instead?
I think there's a lot to be discussed about GDI and UBI. A lot of the reasons people propose UBI would be met within our plan, but of course there are differences as well. If you actually look at the figures put forward by UBI schemes suggested by Basic Income Earth Network and think tanks like Compass, they're proposing a UBI of £60 per week. And the highest UBI proposal we've seen is for £92 a week, I think. And that just falls far short of ensuring everyone has enough money to live. Whereas the guaranteed decent income that we're proposing of £163.50 does that.
Thanks, Ellen. So let's move on to the next section of the plan, which is about support for children. I suppose some people might be surprised to see that in the plan, it's saying that there won't be additional support for children within the guaranteed decent income, but instead that child benefit will be increased. Can you talk me through that?
Yeah, so we've explained this in a bit more detail on page 14. There absolutely needs to be support for bringing up children. And rather than including this in the guaranteed decent income, there's already a very good option in child benefit. And child benefit has lots of advantages and it's simple to administer and understand. But a major problem with child benefit is just how low it is and how you get an even lower amount after your first child. So there is no magic formula for us to decide how much child benefit should be. But looking at the cost of raising a child, £50 is justifiable. And so that is our plan. Child benefit should be £50 per week, and it should be the same rate for every child.
That all sounds really positive, and I suppose people would be asking as well what the impact is. So could you tell us a bit more about what you know about who may be the winners and maybe if there'll be losers from these new plans that you've put together?
So the first thing is that nobody would ever have less than half the minimum wage to live on because of the guaranteed decent income. And today that would mean £163.50 a week. And it's again important to emphasise that for the first time, every person would be guaranteed an independent income, even if they're in a couple. And we did get some modelling done, and the guaranteed decent income and increased child benefits would make 30 million people better off. That modelling found that there are, in relative terms, a small number of households with particular individual circumstances, so they wouldn't get as much as now. So transitional protections could be used to make sure that no one loses out. But we also want to make sure that we do further work on this, especially in relation to making sure that no disabled people lose out.
And you mentioned disabled people there. I know the Commission has made disabled people a key focus of their work when disability benefits often get overlooked. So what was the outcome of that focus?
Yeah, so we did what others before us have skirted around. We looked at what exists, and we agree in principle that an extra cost benefit is needed. And currently, personal independence payment is there to meet the extra costs that we face as disabled people. But any of us claiming it know that it just simply doesn't work. So we've put forward proposals for a PIP replacement benefit, but one that actually gives people that support that they need, that's co-produced with disabled people, and that also recognises that disabled people are the experts on how their impairment affects them. And we want to do more work in a future phase of our project to develop what this process could look like, particularly looking at how, say, the assessment process can be designed with people with mental distress and fluctuating impairments or conditions. We do know, though, that however that work ends up, it would be a very minimally invasive process, truly about working with disabled people to see what financial support we need to live full lives and where we have that control of our lives as well. And there's a lot more I could go into, but I think that's some of the top lines. Our proposals really flip the current PIP benefit on its head and come from a place of asking us, the experts in our lives, what do we need? What support could we have? And of course, nothing like the assessment process in place at the moment. It would be a process truly based on trust. And as the work so far on this has been done by disabled people, making sure it's accessible to us has, of course, been considered and worked through, and things like ensuring the accessibility of the process is at the centre of it as well. And we're proposing 3 rates for our PIP replacement benefit. So there's a lower rate for people who don't need much support, £83.70 a week, a middle rate for people who need more support, £152.15 a week, and a higher rate for people who need a lot of support, £230.77 a week.
Thanks, Ellen. And of course, the Commission's main focus is on social security, but you've gone beyond that, especially in the section on other areas towards the end of the plan. Could you tell us a bit more about what's behind that?
So from our work, it's clear that benefits are being used to try and deal with the problems caused by failings in other policy areas. And it's impossible to fix everything within the social security system itself. So, for example, on support with rent, the housing system is completely broken. In the short term, housing benefit could be returned to for people of working age, as well as pensioners. But what we need alongside any social security system is a large-scale programme of building social housing. And with childcare, rather than debating the rights and wrongs of it being an element of universal credit, one thing that came up in our consultations time and time again was a free early childhood education and care system. And having a national independent living support service is another example. There's lots that we can do within the social security system, and that would improve the lives of many. But it just can't be ignored that there are existing policies and ideas that we also desperately need alongside it.
And you've got this final point in the plan about ethos that you and your fellow commissioners have worked on. So that's not about actual benefits. What is it that you're proposing there?
This goes back to our principle that everyone should be treated with dignity, respect, and trust. And how the Department for Work and Pensions operates is critical, and the current approach is harsh and punitive. What we need is an entirely new approach based on providing people with support. The whole system needs to be underpinned by those two key words, dignity and respect.
Thanks. And I suppose then moving on to a slightly different topic, maybe a lot of people listening to this will think that the proposals sound great, but then wonder how can this all be paid for? This is a question that lots of people end up asking. What would be your answer to that?
So it is something that we've considered since the Commission first started, and the position that we've come to received overwhelming support in the public consultation that we did on the draft proposals. And we set it out on page 20 of our plan. The government has a lot of power when it comes to money and choice. So things like the ability to make or borrow more money, and the option to set higher taxes for rich people or businesses. And when progressive proposals are made, there's always an immediate demand to say, how much will it cost and how will it be funded? But when governments want to fund things, that money can always be found, and they don't explain where it's coming from. So we're avoiding that trap, which also diverts attention from facts like poverty costs the UK getting on for 100 billion a year. Failing welfare benefits create problems for the NHS and many other areas, and billions more are wasted in inefficient tax reliefs and big businesses not paying tax. Social security is an investment, and there is more than enough money to ensure social security for all.
So we're coming towards the end of our conversation now. What's next, Ellen?
So two things. First, with the plan, it hasn't been possible to deal with every issue raised during our work. So further consideration needs to be given to some points like the additional costs faced by deaf and deaf-blind people, and that includes with access to work, British Sign Language interpretation, and sensory aspects as well. On carers allowance, we found that there wasn't consensus on what to do. So future efforts must be made to build consensus on benefits for carers. Secondly, we are going to devise and implement a major influencing strategy. We're working with an organisation called Equally Ours to identify language and metaphors to use in persuading people to support the plan. We want the plan to become a focus for action, not just gathering dust.
Thanks, Ellen, for taking us through all this amazing detail. Last question from me. If people like what they've heard today, obviously the plan you put together is looking towards the future, and is a really kind of big scale, amazing set of recommendations. But what if people want to do something immediately to lend support or to kind of promote, get involved in what you've been explaining today? What can people do?
Start spreading the word. Our theory of change is that one way big change happens is when lots of different people and groups all start saying the same thing. So if you tell one other person about the plan, that's one more person who can add their voice. Share the plan with your network, tweet about it. There's a contact page on our website, www.commissiononsocialsecurity.org. So sign up to the Commission mailing list, and we'll let you know as things develop on influencing. And if you've got any questions at all, use the contact form on the website and we'll get back to you. And if you'd like us to hold a session with your group or organisation, we'd love to do that as well.
I think that is a brilliant point to end on. Thank you so much, Ellen, and to obviously all your fellow commissioners for the work you've done and continue to do. And thank you very much for watching this video, for your interest in the plan for a decent social security system. And as Ellen has just said, please do get in touch and start spreading the word. Thank you.